Okay, we will go on then to the second group, and Tom Scott will be presenting this. This is talking about scaling up successful practices from research to practice in local communities.
We had a really good group, very lively discussion. There were no awkward pauses. We started with a list of 4 questions. Each of us that led these discussions were asked to develop questions, and we framed our discussion around this list of questions. Before I go on, I want to apologize because while I was sitting up here after I had turned in my talk, I found a number of typos I'm embarrassed to say, but don't hold that against the group. That's on me. Okay, so what I'm going to do now is go through each one of these questions, and I have bullet lists. I will elaborate to some extent, and then when we get to the end, I'm hoping that the rest of the people that were in the room will either elaborate or add to the discussion. So the first question was, what are the key components of successful scaling up of public health programs in local urban environments? And we had some discussion about sustainability. Some of us felt like that was an important thing, that you scale it up and sustainable. There was some discussion about whether or not that really is a requirement of scaling up. Personally, I think that it is, in the sense that if it's not sustainable, then there's not much point in scaling it up. The issue of community participation was, I think, very strongly supported as something that's critical for these kinds of programs, and also coverage. So you have to be able to deliver it with appropriate coverage so that you get the public health outcome that you want. It's important that there are measurable, meaningful outcomes. We had some discussion about some of the presentations earlier in the day. The talk that Eva gave, we used that as an example of a variety of things and talked about that, but we think that that is important in terms of the public health outcome. But we felt that those measurable outcomes should not just be limited to public health, that they should go beyond that. So this touches again on the notion of integration and cross-cutting. We felt that there should be some consensus across sectors that deal with urban structure and functional development, and that would include things other than public health. And there were some examples that were given, and some of the people that were in the group might want to elaborate on those when we get to the discussion at the end. But one example had to do with sanitation. There was a lot of discussion across these questions that had to do with implementation plans, and really that's not something that we've perhaps spent as much time thinking about or training people to be able to do. So I'll talk a little bit more about that, but it was felt that in order to have a successful program, it had to have a successful implementation plan. We also felt that there needed to be some sort of an institutional home, some sort of oversight, someone taking responsibility for that. We talked about how there have been programs that have been very successful, but they were largely driven by individuals, charismatic individuals, and when those people went away, the programs went away. So we felt that having an institutional home might be a way to deal with that, but there was also some discussion about training people to fill those roles. There was a discussion about the need for long-term promotion of equity. Albert brought that up, and he may want to expand on that. We felt that it was important to be able to adapt to the local culture and circumstances. That goes, I think, sort of hand in glove with community participation. And that if you have an approach or a product that you're scaling up, if as you scale it up, as you cover a larger area and you increase through time the application of it, if you amplify the impact, then that makes the scaling up process go more smoothly. If not, it could potentially make it more difficult. So that was question number 1. Question number 2 is, how can or should public health scale up be integrated with other development programs? So the first bullet got cut off. That's one of my typos. It should read, integrate consensus across sectors dealing with structure and function of urban environments. And that should not be limited to public health. Engage leaders with the will and the power to implement those programs. And we've talked about that. At what level do you need to identify the leaders who could help this come about? Does it need to be a prime minister? Does it need to be a mayor, as Steve Lindsay talked about? But identifying people who have the will and the power to implement the programs. We felt that it was important to be aware of the political and the private interests that might help or harm the scale-up in the implementation. There might be some political reasons where people don't want slums to persist. On the other hand, there might be some advantages, and those are things that we could use to our advantage when we roll them out. Develop a plan that includes management, governance, finance, and leadership. There's actually a lot there. But to a priori have some notion about how you're going to manage it, govern it, how you're going to pay for it, and who would be in leadership roles and how you would sustain that. This is a question, this next bullet, and it seemed to us that what we're assuming is that we want large infrastructural improvements as opposed to what we have largely been doing right now, which are disease-specific responses. But on the other hand, we also talked about the need for short-term solutions versus long-term solutions, and we see the large-scale infrastructural improvements being something of more of a long-term solution. We did talk about how security might be a motivating factor, and that's something that could be elaborated by members of the group. And we felt that it was really important to increase crosstalk and awareness of the benefits of urban development. In fact, I think there's another bullet coming up where we talked about perhaps it would be a good idea to have a workshop where we brought these different groups that haven't been talking together and have a structured format for addressing that. And we felt that it was really quite important, if you're going to have this sort of a cross-cutting approach, that there needs to be coordination among the agencies or whoever the partners are that are working with one another. The third question is, how do we create a translational pathway from basic science to operational research to health policy, implementation, and the impact in low-income urban settings? And one of the key components we felt with that, and I think maybe this touches on some of the things that Jason was talking about, is there needs to be an evidence base that informs policy. So there needs to be data and science that underlies that. We need to go beyond policy in terms of the implementation and the monitoring. We need to have, we talked about this notion of implementation science. Some people referred to it as operational science, and that might be something that we think about doing before or at the same time that we're developing the policy. So it doesn't necessarily have to follow the sequence of events that are in the question at the top. We talked about how the current situation oftentimes is disease specific and therefore it's fragmented, and that we need to think about how we can develop a pipeline for multi-disciplinary development. So that would be a whole new way of thinking how we would approach these kinds of problems. We talked about how we would like to see investment in core sites, urban slums, with institutional support that could serve as an incubator in terms of developing some of the data that we want to, that we've talked about here, that we need for the evidence base. If we have places that have the infrastructure in place, have historical information, that can be really quite valuable in terms of addressing critical questions. What should the role be of efficacy, effectiveness, cost-effectiveness studies in urban development? So this really grew out of a discussion of randomized control trials, which in many circumstances are considered a gold standard for assessing the efficacy of an intervention. And we had some lively discussion. I don't think that we came to a conclusion on it, but it was something that we think deserves more attention. What should the role of those kinds of studies be in the urban development that would have a positive public health impact. And the last thing was that we talked about having a coordinated workforce. Before I go on, I should have mentioned this earlier, these things are not in any particular order. They're not ordered in terms of priority or so forth. Didn't have time to do that. And the last one was, does one size fit all, or do we have to tailor intervention scale up for each city? And the no refers to the first part of that question. There was a pretty strong feeling that one size will not fit all. We felt like they need to be tailored for the specific circumstance. And I think that that was supported by a variety of talks that we've heard here at this meeting. Implementation science with translatable protocols. So this gets back again to the developing the science and the approach for how we would implement this type of a large-scale change in the way that we do things in cities. And there was some discussion about how that would require programs that would be training a new cohort of young people that would have the appropriate expertise to do that. There's a feeling that that does not currently exist. I think that it's very important that you establish the appropriate and you establish and sustain and cultivate the appropriate partnerships and collaborations. And then we talked about how we might learn from some successful programs. And this would be good when I finish here for some of the people who made these, identified these examples to talk about how that might be the case. That in other words, we don't need to start from scratch. There are examples with HIV in Africa, the polio eradication program, climate change communication, and strategic marketing of drugs. And we could learn from that how we could integrate the kinds of public health impacts we want to see in terms of urban development by following the path that they've already gone down. And then this last one was the one that I also mentioned this earlier. We thought that workshops or a workshop that cut across the topics of urban development, modern cities, and public health might be a way to stimulate the kinds of discussion and exchange of ideas that virtually everyone agrees is a good idea, but really hasn't taken place to the extent that we think that it should have. So I will stop there. So first, members of the group, please contribute. Albert, do you want to add anything?
Very eloquent.
Ah. You know, you weren't this bashful when we were in the room. Okay, thank you.